Jaundice is a common health issue in newborns. About 60% of infants experience this condition, and it increases to about 80% of premature infants born before 37 weeks of pregnancy. Today on Sound Health, we'll find out how to manage neonatal jaundice. I'm Olasumbo. It's so good to have you on the show. The program continues shortly. Please stay with us. Thanks for staying with us. It's still Sound Health on Lagos Television, and today Dr. Adedeji Alabede, a general pediatrician, will enlighten us on how to manage neonatal jaundice. Welcome to the show, Doctor.
You're welcome. Thanks for having me.
Okay, a recent global estimate reveals that about 1.1 million babies in sub-Saharan Africa and Asia will develop severe jaundice. What are the causes of this condition?
Babies are prone to neonatal jaundice simply because at birth there's a transition between the way the jaundice is metabolized while the baby was inside during the fetal life and immediately after delivery, when the liver and biliary system takes over the metabolism. And then you find that babies are born with a lot of red blood cell mass. And most of these red blood cell mass will die slowly. They will be catabolized. And the liver is not ready to do the function efficiently. So that's what usually leads to jaundice.
Aside from a yellow tinge to the skin and the whites of the eyes, what are some of the symptoms parents should watch out for when jaundice sets in?
Actually, the mother should look out for yellowness of the skin, yellowness of the eyes, as much as she can. We do not want to wait until those other more serious signs start appearing before we start attending to a jaundice babies. Ideally, we should have preempted it because there are certain conditions that already tells you that this baby may have jaundice. If the mother's blood group is O positive or the mother has a rhesus negative blood group, those are signs, telltale signs that the baby may eventually turn up with jaundice. So it's something that we should look out for, and healthcare personnel and the parent should be on the lookout for. By the time the child starts having seizures, becoming weak, vomiting, becoming lethargic, serious complications are already beginning to set in.
Immediately after birth or like?
Immediately after birth, usually it's jaundice you are looking out for. So, and healthcare personnel usually we actively search for it because it's not so obvious to the mother, except if the mother is a doctor or a nurse or somebody who has had experience with it before. It's not so obvious. It's the healthcare personnel that will be able to quickly pick it up before it becomes serious.
Aside from the visible symptoms, the yellowness of the skin, are there tests or how do you diagnose jaundice in babies?
Usually we do not rely on visible symptoms alone. Once there's any suspicion of jaundice, we carry out blood tests. In this part of the world, what we do is a serum bilirubin, which tells us about total and the conjugated fraction. And there are thresholds for action. So depending on the age of the child in hours, you want to know what the value is. Did this jaundice appear in the first 24 hours or did it appear after 24 hours? At 36 hours, what are the values? At 48 hours, what are the values? So based on that value is what you now use to determine how fast the jaundice is growing.
Okay, doctor, please share with us the possible complications that could arise from jaundice.
The main complication that could arise from it is damage to the neurons of the brain and then the spinal cord. And we have what is called acute bilirubin encephalopathy. We could also have chronic bilirubin encephalopathy, kernicterus. And this is the main thing. Once the jaundice rises to a particular level and it stains the brain nuclei, it's very difficult to treat.
What are some of the risk factors and underlying conditions when a baby develops jaundice?
If a child is acidotic, if the child has had asphyxia, if the child had neonatal sepsis, or rhesus negative, or sometimes O positive, if the mother had infection just before birth, which means the baby might be at risk.
What kind of infection?
Bacterial infection, majorly. So the baby might be at risk. What are these signs that would tell you that the mother has infection? The mother might have seen rupture the membrane, which means the mother must have seen water more than at least 18 to 24 hours before delivery. Because normally the membrane protects the infant from ascending infections. So when the membrane ruptures, there's an opening. So once it ruptures, the baby must be delivered as soon as possible. If it takes longer, more longer than necessary, then the baby becomes risk for infection. If the baby now has jaundice, then it makes it much easier for this damage to occur.
In this part of the world, oftentimes pregnant mothers are advised to take on ripe pawpaw. Mothers also use camphors and mentholated powder. Would you recommend homemade tips in the treatment of jaundice? What's your take on all these misconceptions or myths?
Camphor and methylated powders are no completely. They are some of the things that have been recognized to further aggravate jaundice, especially if the baby is GCSPD deficient. It's commoner in males. Most often it affects males. It can affect females too, other certain conditions. But if a baby is GCSPD deficient and then they begin to apply camphor, it's an enzyme, glucose 6-phosphate dehydrogenase deficiency. So when this deficiency is there, the baby will be prone to serious jaundice, and it can be accelerated by camphor. And then pawpaw has no use, no relevance to neonatal jaundice. This is what we commonly encounter. Sometimes there's a scuffle between the medical personnel and the family because sometimes they feel that if they don't need to come to the hospital. And I don't blame them. It's because sometimes when they use it, they think it works because the baby seems to get better.
No,
more than 90%.
Even during pregnancy.
Even during pregnancy.
Once you're 6 months pregnant, you should take unripe pawpaw soaked in water.
There is no scientific basis for it. There's no scientific basis for it. So we don't recommend it. I don't recommend it.
Is there any correlation between the color of a baby's t-shirt or the color of the shawl? You hear mothers say the baby developed jaundice or the baby has jaundice because the baby wears yellow t-shirts or yellow shawl or uses yellow shawl. Is there any correlation between jaundice and the color of your costume or clothes?
No, it's not true. The only thing is that it confuses the healthcare personnel. If the baby is a bit jaundice and then is wearing yellow shawl, you may miss the jaundice. And then the baby will now go on to develop severe jaundice. And by the time they come back, it might be late. Or it might be so bad that you've been wondering, so we don't usually advise it. Because when you want to examine for jaundice, you are advised to go to clear light, natural light, as much as possible. So that you can see clearly, so that you can blanch. You blanch the skin, and then you remove your finger, and then you see a transient yellowness. Sometimes it's not so obvious. The baby will be looking pink and healthy, but by the time you blanch the skin and remove your finger, you see the yellowness.
Can you please share with us some of the treatments? What are the possible treatments? Is it treatable?
It is treatable in the sense that you can do phototherapy. There's something what is called phototherapy. We put the baby under fluorescent lamp of different colors. There's blue, there's white, and then they have different wavelengths at which they work. And this fluorescent lamp help you to structurally change the bilirubin, the jaundice. What causes the jaundice is the bilirubin that is present in the blood. So this bilirubin is now structurally changed from the lipid soluble form to water soluble form, which is then excreted. But that one is mainly for certain levels of serum bilirubin. When the serum bilirubin goes too high, you will have to do a blood exchange transfusion.
So how do you prevent jaundice in pregnant women or pregnant mothers, in babies and nursing mothers?
During pregnancy, the obstetricians will have been taking history from the mother, will have been seeing the mother, and they will have identified some of those risk factors that we've been highlighting earlier. They will have identified that the mother has O positive blood group or has rhesus negative blood groups. If it's rhesus negative, there are ways by which they investigate them during pregnancy, and then after delivery, we'll give some injections to the mother to help prevent subsequent one. Usually when you're rhesus negative and you have never been pregnant before, your first baby is not prone to develop jaundice from that rhesus negativity. But the subsequent deliveries are prone. So there are certain injections, they call it Rogam, that they give the mother as soon as the mother delivers, that mop up all the antibodies that is circulating, so that the next baby will not be affected. So each time the mother delivers, they will have to keep doing that. That's a preventive measure. The other one is that they will have health educated the mother that after delivery, we would like you to remain around for like 24, 48 hours, sometimes 72 hours, so that we can observe and look out for all these things that we're talking about. So that even if the baby has jaundice early, we identify it very early, quickly attend to it, it clears off, and then you go home. Most of the problem we have is that it's because of the number of patients that is seen and because of different centers and different healthcare personnel, you find that babies after birth sometimes are delivered 6 hours after, and there's no protocol for seeing them again. Even when they are asked to come back, they don't come back. So it's only during naming, after 8 days, that somebody will identify jaundice. By the time non-healthcare personnel are seeing jaundice, it's really bad.
Are the presentation the same in babies and in adults?
Jaundice affects all age groups. What is different is what causes them. Even in the newborn, it depends on time of presentation. If the jaundice is presenting less than 1 week, all the risk factors we've been explaining since are the risk factor for jaundice that is presenting in less than 1 week. If jaundice is presenting after 1 week, you begin to suspect liver damage. And liver damage is one of the reasons why it occurs in older age groups. It can also occur in adults. Malaria is a known cause of jaundice, especially in adults. When you have severe malaria, you can have jaundice. It can also result from all forms of infections, bacterial infections, viral infections, liver disease, biliary disease. You can have jaundice. So it can occur in all age groups, but we are pediatricians.
Okay, doctor, as we round up this segment, what is the way forward in managing neonatal jaundice? Because in your response earlier, you said most of our health facilities are not equipped with postnatal care. And what do you think can be done on the part of the medical practitioners and on the part of the government?
Government needs to help us. We are supposed to do the job too, but government needs to help in providing more information to the grassroots about the need to go to hospitals for proper care. Government needs to provide facilities. I am aware that the Lagos State government is trying in that regard, but they need to do more. We need to have more facilities in every regard, and those facilities are supposed to be manned by an adequate number of staff, qualified staff, nurses, doctors, so that they will be able to attend to this patient. And then government should provide the equipment that will be used in those facilities. That is one aspect. Journalists like you are supposed to also help us to continue to disseminate this information so that it can go to the grassroots, so that everybody understands that yes, jaundice in more than 90% of the times is harmless, but it's important for them to continue to be seen by healthcare personnel so that they can identify those ones that are likely to become complicated.
Thank you so much, Doctor, for sharing your expertise with us on managing neonatal jaundice.
My pleasure.
Okay, that has been Dr. Adedeji Alabede, a general pediatrician on managing neonatal jaundice. Sound Health continues with trending and home essentials. Please stay with us. The program continues in a moment.
This week on sexual and reproductive health rights. By allowing women to time and space the number of children they want, contraception prevents unintended, often high-risk pregnancies too close together, too often, too early, or too late in life that can lead to maternal and child death and injury. New Guttmacher Institute research estimates that the number of women of reproductive age in developing regions worldwide who have had an unmet need for contraception, that is, they want to avoid pregnancy but are not using a modern contraceptive method, has improved but remains high in 214 million women. These women account for 84% of all unintended pregnancies in developing regions. By satisfying this unmet need for modern contraception, the numbers of unintended pregnancies, unplanned births, and abortions would drop by almost 3/4. Achieving this outcome is a vital goal because the health benefits of helping women to prevent unintended pregnancies are substantial. An estimated 308,000 women in developing countries will die from pregnancy-related causes this year, and 2.7 million babies will die in the first month of life. Fully meeting the unmet need for modern contraception would result in an estimated 76,000 fewer maternal deaths each year and 480,000 fewer newborn deaths. Being able to time and delay births is especially critical for adolescents younger than 18 who are at greater risk of pregnancy-related death and complications and whose children face higher risks as well. For all women, spacing birth 3 years apart lowers infant and child mortality rates. Additionally, longer birth intervals improve other child health and nutrition indicators, such as by increasing breastfeeding and reducing the incidence of stunting and underweight children.
Alright, this is where we say thank you on today's episode of Sound Health. Hope you've learned a few things about managing neonatal jaundice. For comments and inquiries, please send your thoughts to us on 080-818-815-3695 or follow us on social media at LTV Social. #Sound Health. A sound health is a sound mind. Make healthy living your choice.